Went back to see him 15 minutes later and he was sprawled out on the sofa. He couldn't even lift his head up.
Oh, no.
I scooped him up, sat him in the car and rushed him to Guildford Hospital, which is where we were living at the time. And the doctor there said to me, he said, had I brought my son in 5 minutes later, he wouldn't have been around.
Welcome back to the Harley Street Edit, a regular show bringing to you world-class medical professionals from the Harley Street medical area. I'm your host, Shraddha Nand. This week we're speaking to Archna Patel, who is the director and founder of the Acupuncturists based on Devonshire Street. She is a very accomplished acupuncturist. She's been in the practice for over 19 years, and today we speak to her about her journey into acupuncture and really pick her brain for all her knowledge. Archna graduated from the internationally acclaimed College of the Integrated Chinese Medicine, and she started her own practice over 11 years ago. She has a special interest in women's health and fertility issues. However, for the past 5 years, her interest has grown a lot in addiction, and she has a really big passion in stress and managing chronic stress. She's also on the committee for the British Acupuncture Council and is very passionate about opening up conversations to get a dialogue going between acupuncture and modern medicine. During our conversation, we spoke about the basis and the foundation of acupuncture, chi and meridians. She broke down the differences between traditional and modern acupuncture, and then we went through and spoke a little bit about the future of acupuncture and what an integrated system might look like. We also finished up on her favourite health tips and what she does to keep a positive attitude. She's an all-round beautiful human being, and it was a real joy speaking to her. I hope you enjoy listening to the conversation as much as I did having it. Without further ado, here's my chat with Archna Patel. Hi, Archna. Thanks so much for coming onto the podcast. How are you?
I'm really well, thank you. And thanks so much for asking me to join your podcast.
Oh, we're very excited to have you on the show.
Me too.
So let's talk a little bit about how you got into acupuncture. What were you doing before? What's your origin story? What's your background?
Actually, it's quite a strange introduction to acupuncture for me. My background is Western medical sciences. So I studied Western medical sciences and started working in the haematology lab at St. Thomas's Hospital. And I've always been fascinated by how the body works. So I was really loving my job. But, I then started a family and my son was born. And unfortunately, he was a lovely, chubby, happy baby. But as I say, unfortunately, when he was 5 months old, he got quite poorly. And the doctor diagnosed him as having asthma. Now, as a young baby, he was, given medicine. He was given the Ventolin inhaler, but a baby can't use an inhaler, so he was given a volumatic.
What is that? What's a volumatic? And
a volumatic is it's a large plastic sort of oval type container in which you will one part goes over the nose and the mouth of the patient, and the other side it's where you actually administer the drug.
Right. Okay.
So the patient who can't use an inhaler will just breathe the sort of air within the volumatic. Right. They'll breathe in and out so that they will get the medication into their lungs.
Sure. Okay.
So he was given that, and we thought, he'll be fine. He'll get over it. But unfortunately, he didn't. As time went on, his asthma got worse and worse, and being trained in Western medical sciences, I was like, well, if the doctor says he needs an inhaler, that's what he needs. As he got worse, he was then given steroid inhalers. And I was like, okay, that's what we do, whatever it takes.
Yeah.
But as he got worse and worse, he then became someone who regularly needed antibiotics. His lungs were so weak that if there was someone in the room, even if we were in a hall, and someone was on the other side of the room or the hall and had a cold, you could almost bet that my son was going to get that cold. And it wouldn't just be a small, light infection. It would be, he would have a full-blown chest infection. Okay. And so he would be given antibiotics. So as time went on, he was forever taking the Ventolin, the steroid inhalers. He was then taking a number of antibiotics. And even then, he would have to be rushed into the local surgery where they would give him a nebulizer, which was, where they sort of put the mask on the patient, and then, the oxygen is administered with the drug as well. And there would be times when he would even have to be rushed into hospitalized, and he would stay in hospital for a few days and would then have to have steroids. It was a tough few years, but, I thought, he'll grow out of it. Doctors would say that, don't worry, he'll grow out of it. And that's what I thought would happen. So we waited for that time, and it just never came because he just got worse and worse. Now, I can remember this day, and he was about 6.5, 7. I can remember this.
Wait. So this has been going on for this. So from age 5 months, and he's now 6, 7, and this is going back and forth with the steroids, the antibiotics, the chest infections. It's going on for this long.
Absolutely.
Wow.
And the thing is that, the older he got, the more introverted he became. He wouldn't go out and play football with his friends because he would come back wheezing. The really sad thing was that I couldn't, tickle him because if he laughed a lot, he would get wheezy.
Wow.
So this went on for quite a few years. And this particular day that I'm going to tell you about, I can remember it as if it was yesterday. So he started to get wheezy, and after your son goes through this, week after week, month after month, year after year, you almost can tell when a particular attack is going to be worse. And I could sense that something wasn't quite right this time. And so I took him to the surgery, which at the time was just behind where we lived. And there was a locum GP there. And she said to me, Archna, she said, stop worrying. She said, your anxiety and your worrying is actually making him worse. Go home, give him his medications, and he'll be fine. And you won't believe I left. I know.
That's terrible.
I know. I left there thinking, oh my God, I must be a really bad mum. That my worrying and my anxiety is actually making my son's asthma worse.
Oh my gosh.
So I took him back and we gave him, the medication. And, I sort of propped him on the sofa, put some TV on. I thought, maybe him watching some TV will take his mind off it. Went back to see him 15 minutes later, and he was sprawled out on the sofa. He couldn't even lift his head up.
Oh, no.
I scooped him up, sat him in the car, and rushed him to Guildford Hospital, which is where we were living at the time. And the doctor there said to me, he said, had I brought my son in 5 minutes later, he wouldn't have been around.
Oh my gosh.
I know that was probably the worst day of my life. Just hearing that. And I think at that time I was ready to try anything.
Yeah.
Friends, family had said to me in the past, why don't you try reflexology and why don't you try acupuncture, But, I guess I was so blinkered and I was so closed to any other kind of medical treatment apart from Western science or Western medical science that I just wasn't prepared. But at this time, I was prepared to try anything.
Yeah.
And so we took my son to have some reflexology,
yeah,
which seemed to help. But I wasn't seeing the changes that I wanted to see in him, not as fast as I had hoped anyway. And so I thought, well, a lot of people are talking about acupuncture. I read up about it and I thought, it's worth giving it a go. But like all mums, you don't want to put your child through anything that will be painful. So what I did is I booked an appointment with an acupuncturist who lived close by. And I thought, let me go and try it for myself and see if it's painful. If it's not painful, there'd be no harm in taking my son to have the treatment. So I went to see this acupuncturist, and she was asking me all these questions, and in my mind was like, get on with it. I just want to see what the treatment is like. I don't want to answer all these questions. So everything she was asking me was like, yeah, no, not a problem. Yeah, I'm fine. And that was it. She asked me the questions and I just, sort of brushed them off and said everything was fine. Because in my mind, I just wanted to see what the treatment was like. So she had me on the couch, put a few needles in me, and it wasn't painful at all. And I thought, okay, this is okay. I think, my son would be able to manage this. Went home, and you won't believe, Shraddha, within half an hour of the treatment, I was, sorry to say this to all the listeners, but I was on the toilet and couldn't get off for about half an hour.
Oh my God.
And then following that, I had this most intense feeling of cold, and it was an internal cold. No amount of cardigans and blankets and hot water bottles and sitting by the radiator was warming me up. So yeah, she, I spoke to her and I said, look, I'm really not feeling too well. And she sort of said to me, well, why don't you come back? And I went back to see her. Shraddha, she put 2 needles in my abdomen and that was it.
Wow.
So 2 things I've learned from that was it's not painful.
Okay.
But God, it did something that I couldn't explain.
Yeah.
And I don't say this to scare patients off, because I think really the reaction I had to acupuncture was purely my fault, because I didn't tell her what was going on. I mean, I was going through a lot of things. I had some health issues of my own, but I hadn't given her any information. So she obviously did what she did, given the information she was given.
Retrospectively, looking back at your first experience of acupuncture, a question comes to mind then. What was going on for you health-wise? And now knowing what you know about acupuncture and the reaction that you had, can you see the connection? Is there a...
Oh, absolutely. I mean, at the time, there were a lot of emotional things going on, a lot of stress. In terms of my physical health, I was very tired. I was anemic.
Yeah.
But I hadn't shared any of that with her. I was also suffering from pretty severe headaches, which could often turn into migraine. So I hadn't shared any of that with her. In my mind, I just want to know if this hurts or not. Yeah, so as I said, coming out of that experience, I was like, okay, there's something pretty powerful going on here. I do blame myself for the experience, because I didn't tell her what really was going on in my life, both on a physical level, an emotional level, and maybe a psychological level. But at the same time, she put a few needles in me initially. I had a bad reaction. As I say, the fault was mine. But I went back to her and a couple of needles rectified the whole thing. So I left thinking, wow, this is pretty powerful stuff.
So going back to your experience of acupuncture, and then you decided it was going to be appropriate for your son.
Absolutely. So then we booked a whole series of appointments with my son, and he took to it really well. He didn't flinch. So, you'd expect most kids, actually most adults, to shy away from needles, but he was fine. It didn't hurt him at all. The thing is, I've got to say that, I'm not trying to say that acupuncture is a miracle cure. It's not. It is very effective. But in the case of my son, it took some time for him to go from being a severe asthmatic to someone who didn't need any medication and who hasn't had an asthma attack in years. So, we started taking him to have treatment twice a week for a
Wow.
few weeks.
That frequent.
Yeah. I mean, he was really severe.
Yeah.
He was really severe. Showed that year, so the time I had to take him to the hospital where I was told he wouldn't have survived had I brought him in 5 minutes later, that year alone showed that he was on a concoction of medication. As I say, steroid inhalers, the Ventolin inhalers. He was taking a course of antibiotics a month. That year, he had 12 courses of antibiotics.
Wow.
So you're talking about someone here who was really severely asthmatic.
Yeah.
So initially, we took him to have acupuncture treatments twice a week. And gradually, after about 6 weeks, we took him once a week. And maybe after another 6 weeks, 2 months, we then went down to every other week. And now, he was, to be really honest with you, Shraddha, since we've started acupuncture, he's all grown up. He's 32 now. And he only has acupuncture now when he's stressed or when he's got a headache or when, work is getting overwhelming. He has not had an asthma attack since.
Yeah.
So
that's amazing.
He, from the moment we started acupuncture, as I said, it was a regular course of treatments, but he has not had any antibiotics except for 2 courses from the time we started his acupuncture treatment when he was about 6.5, 7.5 to now. But he's never needed to take an inhaler since then.
That is amazing.
So this journey with my son was like, my background has always been, up until then, Western medical sciences, and I could not understand what inserting a few needles into the body was doing that Western medicine hadn't been able to do. So don't get me wrong, I have the utmost respect for Western medicine. And I will always be grateful for the doctors for keeping my son alive. And that is what they were doing. They were keeping him alive, but they weren't getting him better.
Yeah.
And that's what acupuncture has done. So obviously, having gone through that experience, I just couldn't understand what inserting a few needles was doing. And I thought, you know what, this doesn't make sense to me. And I needed to understand the whole process. I needed to understand the whole philosophy. I needed to understand how this worked. And that's how I then trained and became an acupuncturist.
Gosh, that is incredible. It has to be sometimes so severe, so intense, for then your course to change track and for you to move into another direction.
Yeah, which is a shame, really, because acupuncture is so amazing as a preventative form of medicine as well. But most of my patients will come to me as a last resort because nothing else has worked. Or a lot of them don't want to go down the medication route if they can avoid it. So it's not a treatment that people will think of immediately. Well, I suffer from migraine. Let's try acupuncture first before taking a painkiller. It's something that people think about further along their journey of illness.
Yeah. And it's amazing that you can still help at that time as well, because sometimes with some diseases, people are suffering for many, 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 many years before they might even try something that's classed as alternative, and yet still it has an impact and it still has an effect, and it's a positive effect. So that's amazing to know and to be able to offer as well.
Absolutely.
So was it a transition, or did you sort of just jump head in? How did you train? How did you then move into doing it full time?
So actually, I left work when I was about to give birth. And the idea was to go back to work once my son was at full-time school, but that never happened, obviously because of his symptoms and his condition. So it took me a few years to actually pluck up the courage to become a mature student. It was quite demanding, but yes, I went and trained, and I went to a wonderful college called the College of Integrated Chinese Medicine in Reading. And so, it was a pretty full-on course. It was challenging because I had to change my whole understanding of how the body works and the process of disease and how to sort of how people can get better. I had to change that whole way of thinking from the Western clinical way of thinking to a completely different philosophical approach. And that was a challenge, but I think, having seen my son get better, I was willing to be open-minded.
So how does it work then? What did you learn? How do needles in the body have such an impact?
Traditional acupuncture is one of the longest established forms of healthcare in the world. And it was originally established or originally practiced in China and the Far East thousands of years ago. But it's evolved over years. And treatment involves the insertion of really fine needles into specific points of the body that affect the flow of the body's vital energy force, which we call qi. Now, in doing so, the aim is to trigger your body's natural healing process and to restore physical, emotional, and mental harmony or equilibrium. Traditional acupuncture is a holistic treatment, and therefore acupuncturists don't focus on treating just the symptoms, but they also focus on treating the whole person. So as a result, when you have acupuncture, patients don't just experience an improvement in the condition that they've come to see us for, but they tend to also notice an overall improvement in their health and well-being.
So when you say qi, what does that mean?
We as acupuncturists believe that by stimulating specific acupuncture points, a free and unimpeded flow of qi can be re-established within the energy pathways in the body, triggering the body's natural healing response. Now, Western scientists have been trying to study the mechanism of acupuncture for years, and they've come up with several explanations of their own. So one explanation is that acupuncture works by working on the neurohormonal pathways. And what this means is when you insert a needle at a specific point in the body, it stimulates the nerve, and the nerve sends a signal to the brain, and then the brain releases several neural hormones such as beta endorphins. And what these do when they're released, they make the patient feel euphoric, and this increases their pain threshold, and the patient feels less pain.
So it's a very neurological explanation to how acupuncture could be working.
Yeah. So whereas traditional acupuncturists believe in the flow of qi, and if qi is unimpeded and it flows well throughout the body, then health is maintained. Whereas in Western acupuncture or Western scientists, this is their explanation. There's also another explanation, and they believe, or they seem to have found through studies, that by needling a patient, it reduces pro-inflammatory biochemicals. So what these are chemicals which cause inflammation, and by needling a patient, that is reduced, and therefore inflammation in the body is reduced. And there's one more explanation, and this is specifically related to acupuncture that helps with nerve damage. So there's nerve damage which can sometimes result as a chemo-induced peripheral neuropathy, a condition that often causes numbness and weakness in the limbs. And what studies show is that by inserting needles into the body, the brain secretes nerve growth hormones or nerve growth factor, which then helps the nerve to generate. So those are the kind of ideas that are emerging as to how acupuncture works.
But how do you know where to insert? What was the work that you were studying from? What did you learn? These are studies sort of trying to explain it, but how did you know where to insert, or what was the research and the knowledge that you were working from?
So I think, as I say, it was a challenging time at college because we were introduced to the concept of qi and the concept of the meridians or the channels, which is completely different to anything we were taught at university. Where anyone who has studied the human body will know that we have channels of communication. One of the most basic and fundamental channels is the circulatory system. So you have the veins, the arteries, the arterioles, the capillaries, you have the heart, and you have the blood. So you can see the mechanism and you can see the actual product or the actual blood through which flows through the channel. And that is a communication mechanism. It sends blood, it sends nourishment, nutritions, hormones throughout the body to nourish it and to give it messages. And you go to a slightly more subtler level, and that's the neurological system. So you have the nerves and you have the nerve impulses. Slightly subtle only because you can see the nerves, but you can't actually see nerve impulses with the visible eye, but they exist. And that's another form of communication. At the College of Integrated Chinese Medicine, we were taught or we were introduced to the concept of qi and the meridians. And this is an alien concept in Western medicine. But Chinese medicine believes that there is the existence of a much more subtler communication network. And these networks, or this network is called the Jingluo in Chinese medicine, but it's a network of channels or meridians through which qi flows. Now, there's no word in Western medicine that actually translates the meaning of qi quite fully. But loosely translated, qi is the life force that drives every activity in organic life forms. So to be truthful, to be actually, frank and really honest with you, Chinese philosophy and Vedic philosophy believes that this qi, this energy, this life force is present in all material and immaterial aspects of the universe.
So you're talking about human beings, plants, elements,
everything. And Chinese philosophy believes that the human body is filled with this animated, invisible, life-giving force. So when qi flows well throughout these channels, throughout the body, we experience good health, both physically, mentally, emotionally as well. But when the flow of that qi is interrupted, when there is blockages in those channels, then that's when illness and disease or dis-ease is experienced. One of the questions that would arise from that, well, what causes blockages? Or what causes disease or illness? And there can be a number of things, and it can range from trauma, chronic stress, as we've talked about, overworking and not resting enough, bad diets. We all know that we all need to eat a good diet. Sometimes some of us are born with a weak constitution, which makes us a little bit more susceptible to certain conditions. Medication and drugs, so whether they be prescriptive or non-prescriptive medication and drugs, so they come with their own side effects. Climatic factors, so you may have heard that a lot of arthritic patients experience more pain when it's cold and damp. So climatic factors can impact health. But one of the factors which really impact stress is emotions. Now, the role of emotions, or emotions are natural things in life. We all experience emotions, and nobody will have ever never experienced sadness or grief or worry or anger. We all experience emotions. But where emotions become a cause for illness is when they become prolonged, when they become when they're not allowed to be expressed. So, So yeah, that's really what. So yeah, so emotions, so unexpressed emotions. The longer you sit, so of course, but it's absolutely normal to feel anger when something in unjust has happened to you. But when you continue to feel that anger day in, day out, week in, week out, year in, year out, that then manifests and becomes a reason for the energy in the channels to be blocked. So all sorts of emotions, are absolutely vital to life, but they become a problem when they're inappropriate, when they're prolonged, and when they're unexpressed.
Yeah. So you can go from a spiritual imbalance, you can go from an emotional or a psychological imbalance, and then you've got something happening in your body, because that flow, that natural flow of chi is no longer.
Absolutely. So again, because they are not visible to the human eye, it becomes something which is quite unbelievable. People say to me, well, does chi exist? And I'm like, well, you can't see nerve impulses, you can't see the nerves travel, but they're there. And yes, science can monitor that. Science can show you. There are machines, technology that can actually show you a nerve impulse. Maybe science isn't so advanced at the moment that it can pick up on the travel of energy or the passageway or the flow of energy. And hopefully sometime soon it can, but just because it is not visible, it doesn't mean to say it doesn't exist. You can't see air, but it's there. But you can't
smell a fart. I mean, you can't see a fart, but it's there.
Exactly.
Exactly.
So you can't see air, but you can experience it when the wind blows. So, Chinese medicine sort of expects us to be a little bit open-minded and not just be completely blinkered and only believe in what is proven.
Yeah.
So when we go and talk about the acupuncture meridians or the channels, they're actually invisible conduits of energy pathways through which the chi circulates throughout the body. And as I say, they're throughout the body. You have 12 main channels or meridians, and these are often named after the organs or the functions of those organs that they are related to or they are connected to. And then you have another 8 meridians, which we call extraordinary meridians, and these act as reservoirs for chi to nourish the main meridians. And then above that, you have so many more tinier meridians which literally nourish and send communication to every aspect of the body, every cell, every organ. It might be quite difficult to understand the whole concept of the meridians, and I guess maybe an example that I can give you is, and the current situation, when everyone was panic buying, there weren't enough essential goods in the shops. And I guess the example I want to share with you is to sort of make the meridians and the chi more understandable is, well, let's say in the current situation where essential goods are absolutely needed everywhere and they need to be transported from the factory to the shops, to your Tesco or Asda or Waitrose. And what happens in order to do that, you've got your truck and you've got your driver. Now, the truck has to leave the depot of the factory to travel along the motorway and then along the A roads and then along the B roads and then along smaller roads in order to get those essential goods to the shops. Now, in the process of doing that, the driver may possibly experience traffic on the roads. He may possibly come across an accident further up the motorway and he gets stuck behind the resulting pile-up. Or he may possibly find that his truck isn't as stocked up with the essential goods as he'd like because the factory just hasn't been able to produce enough. What happens is at the end of that journey, you've got pretty irate customers, frustrated customers who haven't got their essential goods. And this is pretty much the same with the chi and the channels. The qi needs to flow through those channels unimpeded to every organ, every cell, every bone and skin tissue, so that it can do the function it's meant to do. If there's any blockages, if there's any deficiency, then that's when the organs and the tissues will suffer. Does that kind of make sense?
Yes. For me, it was where when you were giving the analogy of the veins and the neurons, it's just a third element. It's another dimension. And fair enough, we don't have a way to measure it just yet. But like you said, it doesn't mean that it's not there. And I definitely smell a fart when it happens. So yeah, I mean, it's not hard enough for me to know that if we don't know the answer right now, doesn't mean we might not get there later.
That's the beauty of science as well, isn't it? I mean, yes, a lot of doctors are taught to only believe what is backed by medical research or science. But I think, again, the beauty of science is that, allowing yourself to be open-minded is what has initiated research and ideas and phenomena, beyond what our mind could have envisaged before or thought about it for. I mean, thousands of years ago, who would have been able to say that our brain has so many functions? It's just as we evolve, it's just as our science, technology improves, that we can then understand how the body works.
You've mentioned traditional acupuncture quite a few times in the conversation. What do you mean when you say traditional? Why the prefix? Or is it a prefix?
Yeah, that's a really good observation and a very relevant question. It is a prefix, and it's very consciously said. And the reason I say that is, I've had so many patients come to see me, and they'll say, I've tried acupuncture before and it's not worked. And, when I get to talking to them, and ask them, well, what did you have acupuncture for and where did you go? And very often they'll come to see me for something like IBS, but they will have had acupuncture with an osteopath or a physiotherapist. And so I just want to highlight that the reason I do say traditional acupuncture is because I do like to differentiate the acupuncture we do. Now, there actually are 13 different styles or 13 different types of acupuncture.
Whoa.
That are practiced. 13. There are 13 different styles or types of acupuncture that are practiced in modern times. But rather than go through all of them, I mean, generally, they can be categorized into two groups. The first being traditional acupuncture and the second being Western acupuncture. Now, all forms of acupuncture involve the insertion of needles on different parts of the body, and all of them aim to improve the well-being of a patient. So the 10 styles or types of acupuncture that come under the umbrella of traditional acupuncture are styles like Chinese acupuncture, Japanese acupuncture, Korean acupuncture. All of these stem from the East Asian countries. But that's not the only reason they are classified under the umbrella of traditional acupuncture. The reason they are classified is because all of these forms of acupuncture believe in regulating the flow of qi throughout the meridians. And that is what will establish health. So the other category of acupuncture is Western acupuncture. Now, in recent times, acupuncture has stirred up a lot of interest in the Western world. And in recent years, doctors, physiotherapists, chiropractors, osteopaths, nurses, and midwives, so they've all started to incorporate needling into their own practices. But there are three types of needling or three types of acupuncture that come under the Western acupuncture umbrella. And the first one is dry needling. And this is a technique that is primarily focused on the reduction of musculoskeletal pain. and the restoration of muscle function. So what happens is that a physiotherapist or a osteopath may palpate the muscles, and they'll find a tender point or a tight muscle, and they will insert a needle, manipulate it, and then leave it there for a few minutes and then release it or take it out.
Mm-hmm.
So that's dry needling. Medical acupuncture is the other type of acupuncture that comes under Western acupuncture. And this is an adaptation of traditional acupuncture, but it doesn't adhere to the concepts of yin and yang and qi. But instead it believes, as I said before, it believes that acupuncture works by stimulating the nervous system. And this type of acupuncture is generally good for, again, treating musculoskeletal pain, myofascial trigger pain, post-operative pain, and nausea. And there's one more type of acupuncture which comes under this umbrella, and that's auricular or ear acupuncture. And this was developed by a French medic in the early 1950s, and his name was called Dr. Nogier. And this style of acupuncture works on the premise that the ear is a microsystem of the body. So you can elicit an effect on the function of any part of the body by stimulating the corresponding point on the ear.
Mm-hmm.
And actually, many traditional acupuncturists, like myself, now incorporate auricular acupuncture into their practices. I think it's important to say that, and this is for anyone who wants to try acupuncture to help alleviate their symptoms or their conditions, I think it's important to say that all the different types of acupuncture work, but they work effectively within their own respective scopes. So, for example, if someone wants to, someone needs help, or someone wants to see an acupuncturist for IBS or fertility or insomnia, then going to see someone who does dry needling may not give you the effect that you need. So we're all affected within the scope that we are trained to treat. But having said that, even traditional acupuncture, we have our limitations. So if someone is suffering from clogged arteries, traditional acupuncture is not going to be able to clear the arteries. We can help prevent them getting clogged. And if someone has an operation to clear the arteries, we can help in post-operative ways. But even traditional acupuncture is limited.
So between Western acupuncture and traditional acupuncture follows qi and the meridians and the understanding that there's another communication pathway within the body, whereas Western acupuncture is still a bit more targeted. So it might be looking at the presenting symptoms and going on Western understanding of the body. So if somebody is selecting an acupuncturist or somebody to go and have acupuncture from, how do they know who to choose? How do they know they're going to a Western acupuncturist or someone who's trained in the Western way or somebody that's trained in the Eastern way? How do they know they're going to, who they think they're going to?
So I think that, again, is a really relevant question, a really good question. I think it really is important that people find the right type of acupuncture treatment or the right style to treat the issues that they want help with. Now, unfortunately, acupuncture currently is not subject to statutory regulation in the UK. And what this means that anyone can complete a few hours of training and call themselves an acupuncturist. Fortunately, to protect the public, there are a few voluntary regulatory bodies for acupuncture in the UK, and each of them require their members to have a different level of training or a particular level of training. So one of the regulatory bodies is called the British Medical Acupuncture Society, which is abbreviated as the BMAS. Now, their members are state-regulated practitioners such as GPs and chiropractors, and now they require their members to complete about 30 hours of acupuncture training. The other regulatory body is the British Academy of Western Medical Acupuncture, BAWWA. Now, their members are also state-regulated healthcare practitioners such as nurses and midwives. Their requirement from their members is to complete at least 84 hours of acupuncture training. You have the Acupuncture Association of Chartered Physiotherapists, the AACP, and their members are physiotherapists who use acupuncture alongside their original physiotherapy treatments. Now, they require their members to complete around 300 hours of acupuncture training. Then you have the Association of Chinese Medicine and Acupuncture, which is the ATCM. Now, these members are acupuncturists and other Chinese medicine practitioners, so herbalists, and they require their members to complete about 3,000 hours of acupuncture training at a degree level. And the final regulatory body is the British Acupuncture Council, the BACC. And their members are acupuncturists who use acupuncture as their main medical technique. And they require their members to complete about 3,500 hours of training at degree level.
Mm.
So you can see the vast range of training that's required within the different styles of acupuncture or the different types of acupuncture.
Yeah, there's quite a difference in if somebody is doing it in addition to or as their main practice, and then also the level of training and scrutiny that then they would go through as well.
Absolutely.
Because you mentioned insomnia and you mentioned IBS, fertility issues. What other type of problems might somebody come to see you with? And when they do come to see you, what happens? I mean, you know, you've mentioned a form, you've mentioned a consultation, you've mentioned needling, but from start to finish, if I was to, and I'm quite a nervous person, so if I was to come and see you, what would happen?
So I guess we are a practice that we like to consider ourselves as a general practice. We like to see patients who come in with all sorts of ailments, and I can probably sort of share some of the most ailments and conditions that we're really passionate about treating later. But yeah, sure. What would you expect to experience if you were to come to us for an acupuncture treatment? So absolutely, the consultation. So first of all, I think an acupuncturist's job is to look after you and make you feel safe. So I think when you come to see an acupuncturist, when you come to see us, expect to feel truly welcome. You know, it's not a clinical environment. It's not a cold environment. You know, all of us at the clinic are really warm, and you know, you will be really welcome. So that's the first thing you'd expect to feel.
Yeah.
Some acupuncturists, and we especially at our clinic, we send out a detailed consultation form prior to your first treatment, because it's really nice to get an overall picture about what's going on. So your main condition may be recurrent tennis elbow, but the consultation form that we send out will be asking you about your digestion and your sleep patterns. It will be asking you, if you're a woman, about your menstrual cycle. It will be asking you about your family history, your medical history, the drugs or the medication you're taking. It will ask you almost everything to do with your health and well-being.
Mm.
And so we ask patients to fill that out before they come and see us. And then when you do come to see us, we continue the consultation. So we sort of hone into the aspects that we feel need to be sort of looked into more. We'll ask you questions which you will probably feel are totally unrelated to the question or the problem that you come to see us with. But as I said before, acupuncture sees people as a whole. We see patients in a holistic view. And that's why, in order for us to really ascertain the disease process or where the symptoms are stemming from, we'll ask you a whole load of questions. So definitely expect to go through that. As part of Chinese medicine or Chinese medical diagnosis, we will check the pulses on both wrists and we'll look at your tongue. That can give us quite a bit of information as to what's going on in the body. And then once the acupuncturist, or once we have done all of that, we'll decide what treatment protocol or what point prescription to use on you. And I always say this to patients: you may have a friend or a family member who has gone to see an acupuncturist for the very same complaint as you have, but don't expect to have the same points needled as them. Right. Because their disease process, their symptoms may be stemming from something or somewhere completely different. And every patient, every person is an individual, and that's how acupuncture treats patients. I can have 10 patients coming in with migraine, very same symptoms, but their treatments will be different. Well, this is where we kind of differ from Western medicine. So if you go to a doctor with migraine, they'll probably prescribe you with a medicine or a medication that will be prescribed for a majority of people who suffer from the same condition. Acupuncture treatment is very individualized. So once your acupuncturist has decided which points are going to be needled, you'll be laying down on the couch, and the insertion of the needles are actually not so terrifying. And this is probably the biggest or the most frequent asked question I get asked is acupuncture painful?
Yeah. I really want to know.
and you know what? People don't believe me when I say, well, no, not really. But honestly, it's not. It's my answer is always akin to the pain or the sensation you experience when having acupuncture is not the same as when you're having an injection or you're having your blood taken. The needles that we use are super, super fine. They're as fine as a strand of hair. When you're having blood taken or when you're having an injection, they're hypodermic needles. They're thicker and they've got a hollow center. These don't. The needles we use don't. So they're super fine. What I would say, though, is I wouldn't say that it is pain or sensation free. So once the needle is inserted, and when the needle connects with the acupuncture point, there is a sensation. And that sensation is often described as a dull, heavy, dragging sensation. Sometimes that is described as a slight tingling or a sensation of warmth. And people often say, well, what is that? And I guess the best way I can explain it is an acupuncture point. So as we said before, qi travels through the channels, but every now and again it dips into a little whirlpool. And this whirlpool of acupuncture is what we call the acupuncture point. Now, a whirlpool has a vortex. And it's, again, the best way I can explain this is if you've got a sink full of water and you unplug your sink, you get a whirlpool of water and everything gets sucked down into that drain. It has this vortex. It's the same with an acupuncture point. It's a whirlpool of energy. And when the needle accesses that energy whirlpool, it's almost like the energy sort of pulls at the needle. You get this kind of dragging sensation. It's weird because you will never have experienced that before, but it's not painful. It can sometimes be very mild, and it can sometimes be quite intense depending on the level of blockage in the channel, but I wouldn't call it pain. So following that, once the needles are all inserted, an acupuncturist will generally turn the lights down, maybe put some music on and ask you to relax. And again, it's unbelievable, but most of my patients will fall asleep on the couch. And I'll always be saying, well, how can you fall asleep with needles in you? But believe me, you will. Maybe the first treatment. The second treatment you won't, because you're kind of anxious about what's going to happen. But once you sort of accept that this is what acupuncture is and you let yourself go, you'll be surprised at the number of people who snore. And then the needles are usually left in for 15 to 30 minutes, depending on what the condition is and what needs to be treated, and also on your constitutional health. So there are a lot of factors which affect how long the needles are left in. Sometimes, again, depending on your acupuncturist and the different modalities they include into their treatment, and depending on your condition, sometimes an acupuncturist may use something called moxibustion during the treatment. Some may use a technique called cupping, and some may use electroacupuncture.
What are they?
So moxa is a dried herb called mugwort, and what happens is that the herb is burnt, and the heat that smolders from the heat that is given from the smoldering of the herb is placed on top, not on the skin, but just above the acupuncture point. And what this does is that it heats up the energy in the channel, and it stimulates circulation and lymphatic flow. It's great for that. Okay. Cupping is a form of treatment that helps to get rid of toxins in the body and helps with circulation. So in the olden days, they would use glass cups, and they would create a vacuum within the cup and place it on the skin so that toxins and stuck energy can be released. Nowadays, there are different techniques. Not everyone uses a flame in a glass jar. There are suction cups, but there are different types. But that's what can be used. And then electroacupuncture is another form of acupuncture. So needles are placed in the skin, and then the needles are attached to tiny clips, which are then connected to a small unit, which gives out a tiny electrical impulse, which can cause a continual stimulation of the point.
Right. And so I know you mentioned the vortex, and then the acupuncture needle goes into that point. So the idea then, I mean, what happens to that energy? So why would you want the circulation? Why would you want to go into that vortex point? What happens to the energy?
So the acupuncture point is the gateway where we as an acupuncturist can tell the chi in the body what to do. So for example, if there is a blockage in the channel, by needling a certain point in a particular way, we can help the energy to unblock.
So it's getting about that flow again.
It's about getting the flow. If there is a deficiency in the channel, by needling and stimulating different points, you can, and using a different technique, you can stimulate the energy to become stronger.
Right. So it's assisting that energy to come back into its natural state of flow then.
Absolutely. So going on from what happens in an acupuncture treatment. So just wanted to say that, acupuncture has different effects on different people. So some people, after the needles have been taken out, some people experience a sense of complete calm. They can feel super relaxed and sometimes a bit spacey, and sometimes patients can feel really energized. So there are different experiences people have with acupuncture. And I guess the last thing what we would do, what we in our clinic would do, is it's important to know that acupuncture isn't a miracle cure, and usually one treatment isn't always enough, although an acute condition can get better with just one treatment. But usually, as I said, patients come to see us when they've been suffering from conditions over a long period of time. So I just want to say that, acupuncture is powerful, is really effective, but often you'll require more than one treatment.
Mm.
And usually we say that the more chronic a condition, the more severe the symptoms, the more sessions you're going to require. So what we do at the end of the treatment is that we'll sit down with our patients, talk about their experience, if they need to share anything with us, but we'll also sort of give them a sense as to what to expect in their further treatments, how often they need to come and possibly for how long.
What do people come to you for? What's your specialty? What is the things that you're renowned for?
So as I said before, we love to help anyone who's looking to be relieved of their condition and symptoms. So we see patients suffering from migraine, headaches, digestive issues, respiratory issues. We see patients with hay fever. We see patients suffering from a depleted immune system. We'll see women for all sorts of menstrual health, painful periods, no periods, heavy periods. We'll see patients for fertility. We'll see patients who are pregnant. We'll see patients who are having cancer treatment. We have I have a colleague who works with me who offers amazing cosmetic facial treatments. So, we offer health treatments and beauty treatments as well. So we're happy to see patients with a range of conditions and ailments. But I think something that actually I really love to help with and really love to help my patients overcome is pain and stress. So right now, we are dealing with a global crisis that's shaking the world to its core, the coronavirus. However, this crisis has overshadowed an ongoing crisis which has also been threatening the very fabric of what we once knew as normal life. And the crisis I'm talking about is the opioid crisis. Now, although we hear more about the opioid crisis being an issue in America, I just want to read out some figures published by the PHE, which is the Public Health England. It's an agency which the government created to promote better health. Mm-hmm. And what they said, it was a paper, or the figures were published last year in the UK. And what they said is that the survey revealed that 12 million people, around a quarter of all UK adults, are now taking medication. And those medications, if used or prescribed wrongly, are addictive. Now, in the main, these drugs are being prescribed for pain, depression, and insomnia. And the figures suggest that the 12 million identified in the survey have been taking that medication for a year or more, and around 2.5 million have been on their prescription for 5 years or more.
Wow.
I mean, those are shocking figures. Now, anyone who's lived with persistent or chronic pain will know all too well the misery it brings, not just the physical symptoms, but they can be so bad that they can affect the psychological and emotional dimensions as well. It eats away at our resilience and our sense of inner balance. Now, prescription medicines have their place, and I'm not here to argue for one moment that they don't. But generally, when it comes to pain, there are a few conditions that will be resolved through the use of pain medication. Usually the drugs simply mask the symptoms, allowing the patient to get on with everyday life. But the moment you stop it, the pain returns. And that's the danger of this course, because what happens is the individual ends up in this cycle of long-term medication, and the drugs, by their nature, are addictive. And what happens is that they then lead into problems of their own. At our clinic, we see a lot of patients suffering from the symptoms of acute and chronic pain, and that's because acupuncture offers an effective and trusted option for relieving pain completely. But for those people whose condition is so severe that a full recovery is not possible, what acupuncture can do, it can help reduce the pain to the point where the quality of that person's life can be significantly improved. seeing patients not being able to enjoy what the universe has given them, so many good things in life, really does break my heart, and I can't bear to see anyone in pain. So those are that's one of the conditions that I really do like to treat. And the other one is stress. Now, oh my gosh, stress has been dubbed.
Stress. I'm 32. I think I'm burnt out.
It's ridiculous. Stress has been dubbed the disease of the modern times. And we see it in so many patients, suffering from stress. And the thing is, stress comes from all angles. Can you believe it? We are hearing of stories of 5 and 6 year olds suffering from stress.
Absolutely.
The thing is, stress, the word stress, and everyone talks about stress, and the first thing we think about is, oh my God, stress. It's such a negative word, but in reality, stress in small doses can be advantageous.
Yeah.
For instance, stress can help you with the daily challenges that motivate you and help you to reach your goals. And it's also an absolutely vital warning system that protects you from danger, and it produces the fight or flight response. So when the brain perceives danger, it starts flooding the body with certain hormones such as epinephrine, norepinephrine, and cortisol, the stress hormones. And this creates a variety of reactions such as an increase in blood pressure and heart rate. And the senses become super, super focused. So that, let's say, for example, you're in danger. There's a car coming straight at you. So when that stress response, that fight or flight response gets switched on, you're able to jump out of danger. That's great. It keeps us in survival mode. It keeps us alive. But once you're out of danger, the body should automatically go back into what we call as rest and digest mode. It should automatically go back into a calm mode, and you can carry on with the everyday things in life. Well, what happens now is that we're constantly in stress mode. We're constantly in fight or flight mode. Now, in the olden days, we would be running away from a saber-toothed tiger, or we would be running away from, a cannibal from the village, down the valley. Nowadays, our survival mode is not running away from such dangers. Our survival mode is, am I going to be able to meet my deadlines at work? Am I going to be able to make my marriage work? Am I going to be able to discipline my kids to make them good citizens? Am I going to be able to make enough money? The stresses that we're all experiencing now, am I going to be affected by the coronavirus? Is it going to help? Is it going to impact the health of my other loved ones? Am I going to be able to get through the next few months financially? There are so many stresses. We are living in survival mode, and our danger sort of triggers are these. But the thing is, these danger triggers are not momentary triggers. They're there constantly. So we are constantly living in the fight or flight mode. And what happens there is when you're in fight or flight mode, as I said, the blood pressure increases, the heart rate increases, energy from the body goes to the limbs so that you can run away from danger. So you are in survival mode. And what happens when you're in survival mode? All the other aspects of your body, so for example, fertility, digestion, immunity, they all become secondary functions. They become non-important because right now you need to get out of danger. But when you're constantly in fight or flight mode, you're constantly on edge, constantly your body wants to get out of danger. All of these other aspects are affected, and that's when chronic stress becomes a problem. So you then begin to develop conditions like a weakened immune system. You get prone to coughs and colds a lot. You begin to develop high blood pressure. you begin to develop conditions like heartburn, digestive disorders, insomnia, fertility issues, panic attacks, depression. All of these conditions are the result of chronic stress. And the way I like to explain explain stress or fight or flight mode and rest and digest mode is literally having the two pedals in your car, where you've got the accelerator, which is your fight or flight mode, and you've got the brake, which is your rest and digest mode. And if you want to go from A to B, you need to work both pedals in the right way. You need to press the accelerator when you need to move, and you need to press the brake when you need to stop. If you don't, you're either not going to get to where you want to get to, or there's going to be an accident. And it's the same thing with life. We need to be able to access the fight or flight mode when needed, but we also need to press down on that brake and allow our bodies to go into rest and digest mode. So we see a lot of patients who suffer from these conditions and ailments, and a lot of them are as a result of stress. And so what acupuncture aims to do is to not just alleviate the symptoms that they're experiencing, but it, as I've said, before, that what acupuncture aims to do is to restore the energetic balance so that the body is encouraged to move from flight or fight mode into rest and digest mode, and then therefore healing can happen.
And do you find, so if someone is taking acupuncture, they're then not meeting their deadlines? Because you're still going to have your everyday life routines. You're still going to have, pressures at work and things that you need to make sure you're performing for. And I guess what question comes to mind is, am I going to perform less, or am I going to, be affected to such a way that then that's having an impact on my work or my finances or my marriage? Or
actually, that's a really good question, because in fact, by having acupuncture, you can become more focused, you can become more present. So we see a lot of corporate workers who are, so stressed with the deadlines and worrying about their bonuses if they don't meet those deadlines or if they don't perform. And then they end up having, so many ailments that they end up having to take time off work. You either carry on working at such an accelerated mode that you burn yourself out and then you're pretty useless, or you have to take time off work and you can't work anyway because you're off sick. So what we've found is that by treating a lot of our corporate employees, that we're allowing their bodies to de-stress, so that, one, they're not manifesting with conditions where they need to take time off work. They're sleeping better, they're more energetic, they're more focused at work. So when you're in panic mode, you may have deadlines in front of you, but you're not focused. Acupuncture helps to calm anxiety levels, helps you focus. So in actual fact, by having acupuncture, you're a much better version of yourself. If you're calmer, you're not so irritable, your relationships are going to be much better. So all in all, acupuncture encourages a person to be a better person or a better version of themselves.
I know I said it as a joke before, but actually it's a very real thing. A lot of peers, colleagues, friends within my age group have experienced versions of being burnt out themselves. And for me personally, meditation really helps, mantra really helps, doing some yoga in the morning really helps.
Absolutely.
So these things that slow me down do help to then make me more alert, more creative, more productive. And that's exactly what you're saying with acupuncture.
And I think I would advise everyone to do exactly what you've just said you do, because I think that helps. But then if it comes to a point where the stress is unmanageable, when you become overwhelmed, when they manifest in symptoms, and meditation and breathing and mindfulness isn't as helpful as it could be, then that's when I would suggest you try acupuncture. But absolutely, these are techniques that we should all be doing.
Mm. You mentioned you started off in hematology. You're in acupuncture now. So that's a Western beginning and Eastern current state. How do you, obviously you would be, I mean, you're a vessel where you've experienced both, and so you've got that blend within you. But, you know, if you want to see more of an integration between the two, what does that look like to you?
Absolutely. I think this is such an important point, and I'm so passionate about looking towards a future healthcare system where there is integration between Western clinical medicine and complementary medicine such as acupuncture. Because if the last 3 weeks have taught us anything, it's that nothing works quite as well in isolation as it does when we're a part of an integrated approach to living life.
Mm.
Now, I think the same is true for health and well-being. Western medicine is largely built on the fundamental need to cure illness or symptomatic illness, so symptoms. It focuses on what a person's symptoms are. So, for example, if you went to see your doctor for a urinary tract infection, what he'd do is give you some antibiotics. So on one level, that's absolutely fine. But the medicine deals with the bacteria, but it doesn't look beyond that. So what I'm trying to say is, for example, we know that cystitis is caused by a bacteria called E. coli, and that lives in the gut of every single human being. But when that bacteria becomes proliferated, you begin to experience the symptoms of cystitis. So fine, the antibiotics will kill the bacteria. So what Western medicine doesn't do, but acupuncture absolutely does do, is look at the body holistically. So what an acupuncturist will do is question, well, okay, you had cystitis, you had the antibiotics, but why did you get cystitis in the first place? Why did the bacteria replicate, and why did it proliferate so much that you experienced the symptoms? If you're someone who is getting recurrent symptoms, why are you getting recurrent symptoms? So we look at things beyond just the symptoms. We look at why a disease or symptoms have actually manifested. On top of that, many of the prescriptions given by GPs, such as analgesia or anti-inflammatory, simply mask an underlying problem. So they don't always cure the problem. So we think, say for example, someone suffering from headaches, take a painkiller and we think, yep, my headache's gone. But it's not really gone, you just can't feel it because the painkillers have numbed it. It's masked the symptoms. So it's fine if you have the one-off headache, but what if you're getting recurrent headaches? Does somebody want to still take medication day in, day out to just mask the symptom to get on with everyday life? Surely there must be a need to look at why somebody is suffering from recurrent headaches. And not only do a lot of the medicines mask the underlying condition, but a lot of the treatments carry their own complications as well. So the side effects of the medication, and also, let's say, for example, complications of invasive surgery. So when I say this, I don't at all mean this as a criticism for Western medicine. In fact, I think Western medicine is phenomenal. And as we've seen over the past few weeks, all of those who practice Western medicine are phenomenal too. But it's limited. So for me, an integration of Western and traditional medicine, and in particular because I'm an acupuncturist, the integration of Western medicine and acupuncture is the way to effectively manage patient care in a way that improves individual recovery and reduces the pressure both on waiting rooms and the waiting list. I think we can. I think we have a responsibility to all the patients we see to offer them the best healthcare system. If we can offer them a system which alleviates the symptoms, which prevents them from coming back, which minimizes the side effects of the treatment plans, then I think we're offering the best we can to our patients.
Mm. And that's a healthcare system where you've got acupuncture as an actual department or a referral, or, you know, where you've got acupuncturists who have trained in it to such a point where they're offering it as their primary source of care.
For sure. It can be any style of acupuncture. So, for example, I know GP surgeries who offer acupuncture, and they will incorporate the acupuncture, which may be dry needling, or medical acupuncture for relief of back pain.
Mm.
So rather than someone going in for pain and seeking help, and rather than saying to them, okay, we'll take these painkillers, offer them acupuncture and see if that will alleviate. And you'll probably find that will do so. And the patient doesn't even need to go on painkillers. I work with a wonderful obstetrician, and he often says, I have no idea how acupuncture works, but I know it works. And what he does, he sends a lot of his obstetric patients to me if there are any complications in labor or complications in pregnancy, for example, nausea or pelvic girdle pain. But he also sends a lot of his patients to me if he thinks a patient is possibly going to need medical induction for whatever reason that he sees fit. He will always say to them, try acupuncture first and see if acupuncture can encourage the body to do what it's meant to do and prepare it for labor. And what he's actually said is that ever since he's been sending patients to have acupuncture, the number of medical interventions or the number of medical inductions he's need to do has dramatically reduced.
Wow.
So why offer a patient a drug to bring on labor when acupuncture could possibly help? So these are just small examples of conditions, but I feel that acupuncture can work so well hand in hand. You know, depression. You know, a lot of patients suffer from mild depression, and doctors, you know, are beginning to give them lifestyle tips that they can do to overcome that. But a lot of them are still being prescribed antidepressants.
Yeah.
They themselves come with their own problems. You know, acupuncture can help. So that's what I'm saying, that I would love to say, do you know what? I think, and this probably is way out, but I would love to see a healthcare system where there is no differentiation between Western medicine and alternative medicine or complementary medicine. I think it would be ideal, it would be wonderful to see a healthcare system which is a healthcare system that will offer whatever is best for that patient. So there's no differentiation. Yeah. We all work together for the betterment of our patients.
I think we're in alignment there, which is why on the podcast we're definitely going to be bringing specialists within the modern fields, but also we're going to be bringing in what are called therapists, but also they're definitely specialists in their own field like yourself. So it's going to be a source of information for all specialties and modalities.
That's brilliant. I'll be waiting to listen to all of them.
Thank you. One thing that we ask everybody that comes onto the podcast is their health secrets. So 3 things that you do daily or regularly that are your go-to things that help you feel healthy or be healthy.
As I said, acupuncture is about treating the whole. And I think, I could say, well, eat healthily, exercise regularly, but I think those are things people know about. What I feel is really important, what I feel keeps me healthy on all levels is, well, first of all, I think it's so important. It may sound a bit corny, but I think it's so powerful, is to practice gratitude every day.
Mm.
I think it's so important to take a little bit of time out of a busy schedule and just sit down and think of everything in your life that you can be grateful for.
Mm.
I think that's very soul lifting. The other thing I do regularly is, and I would recommend other people to do, is to either read or listen to something which is positive.
Mm-hmm.
So read something that's positive or listen to positive thoughts at least every day in your life. So again, take some time out to read something which is going to be inspiring, mm-hmm. which is going to put a smile on your face. That's the second thing I would do. And the last thing,
I'm going to just interrupt you there. What are you reading at the moment then?
So at the moment, I'm reading a book which is based on Vedic philosophy, which is a compilation of the discourses that have been delivered by for a better word, my spiritual father. So I make sure that I read a few pages of his thoughts every day.
Mm-hmm. If somebody was going to start with a good book, what would you say is a good starting book or a good starting place?
It really depends on what their background is and what they like to listen to. But if someone's quite philosophical, a really easy and simple book is Jonathan Livingston Seagull, and it's amazing. It's about a seagull who dares to be more than a seagull. He dares to fly higher than any seagull. So it's a book that's so positive that allows you to go beyond your comfort zone. It's a book that encourages you to spread your wings.
Yeah.
So
that sounds like a great book. I might just add that to my Amazon list. Okay, and your third thing?
Yeah, do you know, I think, see, most of the things I do are very soul lifting. So practicing gratitude, I think, keeps me grounded, and it connects me to the good things in life. It connects me to everything good that's in my life. I think reading something positive allows me to cultivate a very positive mindset. And I think the last thing that I would like to do more of, I do, but I would like to do more of, is to do one thing in the day which is selfless.
Okay.
To do one thing for somebody else in which there's going to be no personal gain.
Yeah.
And that could be something as simple as picking up a phone and speaking to somebody, a relative that you've not spoken to in a long time.
Yeah.
It could be, it's a bit difficult in these times of social distancing to do anything much more, but reach out to somebody you've not spoken to. Remind a person of something good that they've done to you in the past, or remind them of, a quality they have. But when we can get out there in the world, do something nice with it, something small. It can be as simple as doing something like, giving up your chair, your seat in a train for somebody.
Yeah.
It could be letting someone pass. It could be smiling. How many times have you sat on the train and looked at the person opposite you and thought, God, what a miserable person.
Yeah.
And yet we have no idea what their day has been like. We have no idea what's been going on in their life. Wouldn't it be just nice? They may think you're crazy, but hey, doesn't matter. But wouldn't it be nice to just catch their eye and say, hi, good morning? Or,
yeah. You're right. You know what? It's so true, because on Thursday, I had to go into work and more people smiled, even though there was like significantly 98% less people. There was about 10 people in the entire station. But more people looked at me, more people smiled, and I had somebody ask, "Hey, how's it going?" Which just doesn't happen. So yeah.
And and they said this to you?
Yeah, I was walking past them. We were on the pedestrian crossing going in opposite directions, and they're like, "Hey, how's it going?" And I was like, am I going to stop? But I was in a rush and I wanted to catch my train, so I didn't. But I could have stopped and we could have had a chat, keeping the 2 meter distance,
But just someone saying to you, "Hey, how's it going?" How did that make you feel?
It put a smile on my face. So yes, I think you are definitely on to something there. That's been an amazing conversation. So informative.
Thank you so much. It was an absolute pleasure to talk to you.
If people do want to find out more about you, where can they find you?
So they can go to my website. They can go to my Facebook page or my LinkedIn page.
Okay, wonderful. And that's the Acupuncturist.
That's right, with a plural, yes.
Okay, wonderful. So I will link all of that out onto our website anyway, but it's been a pleasure. Thank you so much.
Thank you, Shraddha. It was great talking to you too.
I hope you enjoyed today's episode. You can find all the information for this episode and others on our website at theharleystreetedit.com. The easiest way to connect is on Instagram, and that is at the same handle as the website. So, the Harley Street Edit on Instagram. And finally, the obligatory disclaimer. This podcast is for general information only, and the advice and recommendations discussed do not substitute medical advice, diagnosis, treatment, or care from a physician, healthcare professional, or any other primary healthcare provider. In the consumption of this podcast, there is no healthcare professional and patient relationship formed. The use and application of the information discussed is at the sole discretion of the listener. The details and opinions shared are not meant to be a replacement for primary care, diagnosis, or treatment.